25th anniversary conversation with Dr. Beers. Welcome. We are celebrating our 25 years of serving DC kids, and Dr. Beers has been one of our partners since almost the beginning. So delighted to have you here. We had an extraordinary amount of interest in this topic and in hearing from Dr. Beers, but also a lot of people who said, but I just can't make this hour. So we are recording today, and we will make it available to anyone who wants to watch it on our Helping Children SOAR and childrenslawcenter.org websites. So let me just take 1 minute for housekeeping, and then I will introduce Dr. Beers and we can get her to tell us things that we want to know. I hope those of you who joined early were able to move around the virtual conference room and connect with friends and colleagues. If you've just joined us, at the end, you're going to have an opportunity to mingle with other guests after we talk with Dr. Beers. And I did want to share, we've received a lot of questions already from the audience when people registered, and I'm going to be raising them throughout the conversation. But if you have an additional question for Dr. Beers, post them in the Q&A feature, and we're going to try and get to them. Finally, if you have any technological problems and you need any assistance, you can send a private chat to Jasmine Vincent. That's Jasmine Vincent. And if you press on the chat button, you will find her name under private chat. Okay, now let's get into the topic. Let me introduce Lee Beers. She is currently the president of the American Academy of Pediatrics. And so the District of Columbia is having to share her with the nation, which we are willing to do only for the year. She is also still a professor of pediatrics in the medical direction for community health and advocacy at our local Children's National Hospital. I've known Dr. Beers for many, many years, and I know she's an excellent pediatrician because she is the pediatrician for some of my grandkids. But she's also fighting for kids outside of her clinical practice and has been doing so for decades. Just a couple of things before we get into the questions. Dr. Beers is an incredible visionary. She launched the Early Childhood Innovation Network, which some of you may have heard of, which brings trauma-informed care to children in early childhood and pediatric settings. She brought Children's Law Center to be one of the strategic partners in the policy arm, so we've been having a chance to do work together with that. And together with Lee, Children's Law Center has launched many programs to improve children's health, and stay tuned this fall because we will be rolling out a really comprehensive plan for reforming children's mental health across the city. Perhaps most relevant for today's conversation is that Dr. Beers isn't just an expert, she's also a parent of 2 DC public school attending students. So this is both professional and personal for her. Okay, let's get into the conversation, Lee. We've received an awful lot of questions, and most of them are about the safety of sending kids back to school. But before we can talk about that, I think we need to sort of build the foundation about our knowledge about COVID, make sure that we've got the right information and about the vaccine and the implications. For all of you listening who are really wanting to ask questions about return to school, I promise we're going to get to those. But I do want to take a few minutes to build up to that so that we understand what's going on. You know, I was thinking that since March 2020, we have been told a lot of things. We were told first, don't touch doorknobs, but you don't have to wear a mask. And then we were told you should wear a mask. And then we were told you only have to wear a mask indoors. This was an old person's disease. Now we're hearing that young people are getting it. So I want to, Dr. Beers, if we could wash away all of the 18 months of learning and just start with the best knowledge we have now. Can you tell us who is COVID affecting and how should we be protecting ourselves?
No, absolutely. And actually, Judith, before I dive in, I can't help myself but to return the gratitude in favor of that lovely introduction. It has been one of the really great highlights of my career to work with Children's Law Center in so many different ways. I saw it, and thank you, Tracy. It's a very nice comment, but I remember, I was a very young, early career pediatrician, and Tracy was brand new medical legal attorney at Children's, and we had our offices right next to each other. And so just really, it's been such a pleasure to work with you, and you've made it such a difference for kids all across and families all across the city. So I just appreciate that, and I'm really happy to be here today. But yes, I'll dive into COVID. So I think you're exactly right, and I think I think about this a lot, right? Just when I think about where we are now and where we need to go, it's been a hard year and a half for so many reasons. But one of them is that when this first happened, I think we didn't know what was ahead of us, and we didn't know everything about the virus. And so there was this tension, I think, between communication and transparency about the information that the public health system, I say we, like the public health system as a whole, had, that tension between transparency and communicating information as soon as you had it, and confusing the heck out of everybody. So sometimes you got it right and sometimes you didn't. And I think, one of the, early in the pandemic, a lot of the decision making was really based on prior experiences with other viruses, and trying to do our best job to really project what that might mean for the current virus and the current pandemic. I think, one of the, as much as we all wish that we weren't still in this place, one of the good things about it is that we now have almost a year and a half of experience of seeing what COVID is in real life. And that can really inform us, and so I think, just as a summary, I think a couple things. One of the things we know about COVID, you mentioned, is an old person's disease, a young person's disease. I mean, the way I like to think about it is yes and yes, right? It impacts everybody. Every person can get infected with COVID. Every person can have very mild symptoms. Most people actually do have very mild symptoms. Some people can get very sick. If you are older or have, more significant chronic health conditions, you're more likely to get more ill. If you're younger and otherwise healthy, you're less likely to get ill. And I think what sometimes gets lost, especially, the media is all about headlines, right? So what sometimes gets lost in that is that you can be, you can be older with health conditions, get COVID and do fine. You can also be younger and a child and get COVID and get really sick. It's just the relative risk is different, right? So it doesn't mean, but I think the second piece, which is now we're in a place where we can really be having this discussion, is really, we want everybody to be protected. We don't want anyone to get infected with COVID if we can avoid it. If there's a risk that they might get sick, we feel this way about flu, we feel this way about other vaccine preventable illnesses. And so we want to, think about how do we keep everybody healthy? If there's a preventable illness, we want to prevent it, whether it's low risk or high risk, for infection.
Let me ask though, can I focus on kids?
Yeah.
Feels like we're hearing a lot more about kids getting sick than we were 6 months ago.
Yeah.
But the Washington Business Journal had an article yesterday suggesting that the number of kids who are actually hospitalized in DC at Children's is not greater than it was 6 months ago, or at the height of the pandemic.
Right.
So are more kids getting sick because of the variant, and are they getting more sick than they were before, or is this a continuation?
So it's a really good question, and I'll caveat almost everything I'm going to say with, as much as we've learned over the last year and a half, we're still learning. The other thing I'll caveat, and I think this is a challenge for us in pediatrics, but also an opportunity for doing better moving forward. States have not done the best, or the CDC have not done the best job of collecting child data. That really is disaggregated. That really gives us the best picture. At AAP, together with the Children's Hospital Association, we've actually pulled all the data that's there and available. So it gives us actually a pretty good picture. But I'll just, I always like to give that caveat. But I think between the data that we have and the experiences that we're learning from people on the ground, I think we do have a good picture. And so what we're seeing now is that the Delta variant doesn't actually seem to be causing more severe illness in children. However, it is more contagious. And so just as, children may spread it less, but if it's more contagious, If it's a more contagious variant, they're going to spread it more, just like in adults, they're still going to spread it more. And now we actually have a pretty good percentage of our older adults who are vaccinated, which means that and vaccination still is really good protection against COVID and particularly against hospitalization and death. But if you've just got a higher percentage of the vulnerable population in the US who are kids, which means that more kids are going to be getting infected. A small percentage of a larger number is a larger number, is sort of the way I think about it. The other thing actually that we're seeing, which is really important and concerning, is that we're seeing a lot of these spikes concentrated very regionally. And so particularly in the South and Southwest, we're seeing huge spikes. And so what's happening is that we've got those are areas where there's pretty low rates of immunization, even amongst adults, low rate, not a lot of preventative measures being taken, rare masking, rare preventative measures being taken. And so the Delta virus is spreading faster. If more people are sick, more people are going to have severe illness. But then also the hospitals are getting overwhelmed because they're also taking care of all the other things that are out in the community. We're seeing a little surge of RSV. We're seeing, there's the regular summer accidents and illnesses. And so now the hospitals in these areas are getting overwhelmed, which means that they're not able to provide the best possible care, frankly, because, people are waiting for care and waiting in emergency rooms. So you have this sort of coalescing of factors that mean that we are hearing about more sick kids because we're seeing them. It's not that the percentages are greater, but because Delta spreads faster and because it's so concentrated regionally, places where it's happening, it really is. It is a more dire situation in the places where the rates are pretty high.
And then let's talk about non-vaccine protection for kids for the moment. One of our audience members asked, can our kids play outdoor sports safely without masks, soccer, basketball, things like that? And I think as you answer that, if we're thinking about our kids not yet in school, what kinds of precautions are the right ones to be taking now?
Yep, it's a really good question. And this is where this is such an important concept that we talk about a lot. And I think it's incredibly important to remember. We talk about layered protections. I think in public health, you have to design things knowing that you don't live in a perfect world. Because if you design it thinking you live in a perfect world, it's going to fail. And so you have to design your recommendations knowing that, your kid's going to pull their mask off, or, they're going to wipe their nose and touch something, or, those you have to design. So that's where these layered precautions come into place. So, you said, aside from vaccine, but I can't help but say it.
Okay.
Vaccination is one of the most important things for anyone 12 and over who's eligible for the vaccine. That is one of the most important things you can do. And that helps protect you as a person, but it also helps protect the rest of your community, because it means that the virus is spreading less in your community. There's less of it. There's less of it for unvaccinated children to be exposed to. So we call it cocooning. It's a way of protecting our little ones, even though you're the person getting immunized. But the other things, masking, just simple cloth or surgical masks. It's not 100%, but it does pretty dramatically decrease the transmission. Hand washing, keeping some distancing, right? Like where it's reasonable. But I also think you got to remember, we live in a world where the kids are going to pile on top of each other. They're going to push up against each other on the soccer field. They're going to, indoor transmission is greater than outdoor transmission. So I think to get back to the question of, is it safe to play sports outside without a mask?
Yes.
I think I can mostly say, what we've made the decision for my own kids is that we decided yes. What I think when we and Judith, you and I talked about this a little bit, we're used to managing risks all the time for our kids and our families. I mean, the example I was sharing with you is that my daughter is 16 and just got her learner's permit, right? And so we're taking a risk every time we get in the car with her. It's true, and so we still do it because that's something that that's a risk calculation we've gotten used to, but it also doesn't mean that we don't put on the seatbelt. It doesn't mean that we like let her text while she drives. It doesn't mean, you know, we still do all the precautions. So with COVID, we just haven't, you know, we haven't had to figure out how to navigate this risk. And so we're having to try to figure this out all at once. And so, you know, so back to the soccer area, back to the outdoors
Yes.
question, you know, for my own kids, you know, what we decided was, you know, as younger, healthy kids, they are at pretty low risk for getting serious infection, you know, quite low, right? Not zero risk. So it's not like we're going to do nothing, right? But low risk. Spread is less outdoors. The exercise and the sports is really important for their social, emotional, and other aspects of their development. You know, really important to give them the opportunity to do that. And so when you balanced all those things, we just, you know, that was the risk we took. Now, I will also say, you know, earlier on when things were a little more uncertain, there were some, we would have been okay actually with our kids playing without masks on the field. Off the field was a different story. But there were other parents who weren't. So we said, you know what, that's fine. Everybody should just wear a mask. It's about taking care of each other and doing what people feel comfortable about. And so, you know, so I think it's about taking care of each other. So that was a long answer. But hopefully it was helpful. Hopefully it was helpful.
And I think I mean, one of the takeaways is that part of what's going on is that we don't yet know how to think about the risk, and there aren't easy, clear answers, so that people are making this analysis without all the information that would be that we could use if we were making it. We did get a question honing in on specific kids, which is kids with asthma. Mm-hmm. Can you talk about the impact of COVID on kids with asthma? And how, if you have a child with asthma, how should you think about the risk differently or take different precautions?
Yeah, it's again, really good question. I'll add the same caveat that we're continuing to always learn. It's sort of I don't know, I can't help myself but to say it. But what we know, you know, what we've been seeing actually is that children with well-controlled asthma really don't seem to be at higher risk for severe infection with COVID. You know, I've talked with our pulmonary people, other pulmonary people. There were actually some early studies that, and I wouldn't, you know, I think I would take this with a grain of salt. There were actually some earlier studies that suggested it might be protective actually against serious illness. So again, I would take that all with a grain of salt. You know, again, we try to look at the whole body of evidence. Kids who have severe or severe uncontrolled asthma. So, you know, they've been, you know, over the past 6 months in the emergency room multiple times, maybe needed to be admitted, needed to go on, you know, oral steroids or other medications because, you know, those kids I would be a little bit more careful about. I think generally just because their respiratory health is not great. But I think it gets back to what we really want to focus on, whether we're in the pandemic or not, is making sure that kids' asthma is well controlled. Because if their asthma is well controlled, then they don't seem to be at increased risk. I think, you know, one of the things as our experts, and I know we'll talk about, we can talk a little bit more about our guidance in a little bit, but as our experts really looked at all the different aspects of you know, impacts of COVID and impacts of not being in school and all these other things when we developed our guidance. I mean, they're feeling, and this has been borne out by actually pediatric expert groups across the country, is that in the vast majority of cases, the risks of not going to in-person school far outweigh the risks of going to in-person school. And so I think, you know, that's just as a general statement. Of course, each situation is individual, and you should always talk to your pediatrician if you have questions. But I think, you know, it just, to put it in context, there's actually few situations where the infectious risk of COVID really seems to outweigh the risks of not returning to in-person school.
Interesting. And we're going to delve into that. But before we get there, a few more questions. In terms of risks for kids, got a wonderful audience question, and I know it's been on the minds of a lot of my colleagues, which is, as a vaccinated parent, remember the audience wrote that they teach at a university where masks are optional, as are vaccines, and so he's going to be teaching in a classroom where probably 80% of the kids are vaccinated. but not all of them, and has children under 12 at home who are unvaccinated. So the question is, by going to work and being in a setting where he can wear a mask, but he might be around some unmasked, unvaccinated folks, what kind of risk is he putting his own children at, and how to think about that?
Yeah. Yeah. I think in that situation, I would say pretty low risk, actually. I mean, and for a couple reasons. One, right, again, as someone who's vaccinated, we know there are breakthrough infections. It does happen. It happens with every single vaccine. That's an expected part. So we know that happens, but they're not terribly common. So you've got that protection. If you're wearing a mask as well, you're again giving yourself some additional protection. Again, we know the masks work better when everybody wears them, but gets back to this concept of layering protections, right?
Okay.
You've got your protection of the vaccine and you're layering it with a protection of mask, presumably with college students. They're not like toddlers where they're going to be climbing on you, so you can keep the physical distance from each other. And so you've got you've got multiple layers of those protective layers of protection to help keep you safe. So I think, from what it's just being described, it sounds like a pretty low risk situation in terms of the particular professor contracting COVID and bringing it home. Now, of course, I think that it does remind me to just sort of think a little bit about, it's a great, I love the question though, because it's really thinking about how do we protect our kids, and how do my decisions impact our kids. And I think that's a really important thing for us to always be thinking about. I know in my own house, I think, we've thought, we've loosened up a little bit since we were all vaccinated. I'm grateful to have all kids who are over 12. We've loosened up a little bit, but we're still careful, right? Because we want to, we want to do our part to keep the community spread down. And so, sometimes we make a decision like, well, maybe we're not going to eat indoors now,
right.
Or we're not going to, so we are. So I think I love the framing of the question, sort of thinking about how do my actions impact the kids around me who may not be eligible to be vaccinated, because I think it's important for us to think about that.
Great. And so before we get to talking about schools, I want to take a little bit of a detour and talk about the vaccine generally. And can you just talk about, like, why do we have to test it separately for younger kids? Like, why aren't our 5-year-olds able to get vaccinated now? Just a little bit to help us understand what's going on with the vaccine.
Yeah, it's, oh my gosh, we're like, I share the eagerness for the little ones for us to have a vaccine for the little ones. We're working on that. To the point that within what we think is safe, right? So I think, this is actually a very normal part of the vaccine development process or any other medication trials, right? Judith, you and I were talking about how I feel like the general public knows more about vaccine development than really ever. But the way trials will typically go is that you will test a vaccine or a medication in adults first. Adults are able to consent for themselves. They're fully grown. They're less vulnerable populations in a lot of ways, and that ethically is the right thing to do. And then from there, you start to work down in age. So I think a couple of the things that we're thinking about with the pediatric trials, first is, the dose the same? For a 16-year-old, I think everybody felt like, yeah, it's probably going to be pretty much the same for a 16-year-old. For a 6 or 7-year-old, that's another question. And so that's one of the things that they're looking at in the trials. And in fact, with the trials that are happening now, kids are getting different doses of the COVID vaccine to test safety, to test efficacy. I mean, we know it's safe, based on the adult trials. That's again another part of the reason you really confirm safety in the adult trials and then move to the pediatric trials. And so one of the things they're looking at is dose. They're also sort of checking to make sure that there aren't any different side effects or unexpected side effects that we didn't see in adults, and monitoring that very carefully. Looking to see what the dosing intervals are as well. Is it the same? Is it different? I mean, you think about with infants, when we give them their vaccine series, you get a couple really close together and then it spreads out because their immune system works a little bit differently. And so kind of thinking about how close together they are. So those are all things that they're looking at with the vaccine trials. So yeah, go ahead.
And did I understand you to say that there's not a concern about safety, that it's so the vaccine trials that are going on now are not testing the safety in little kids, but it's actually just testing efficacy?
Mostly. I mean, I think
Okay.
we're always looking for safety. We're looking for safety in the trials, for kids and adults. We're looking for safety in the post monitoring. I don't know any of you who've gotten the vaccine, if you sign up for that sort of VSafe alert where you get a text every once in a while, to say, have you had any new symptoms, that post monitoring. So, so we're always looking for safety. But I think what I meant by the adults, you feel, really confident that the vaccine is safe. We wouldn't, we wouldn't
Right.
take it to trials in adults if you didn't feel really confident it was safe.
Mm-hmm.
The trial sort of helps confirm that, or shows you something that you weren't expecting or were surprised by, and really and knowing that biologically kids and adults are we're there's differences, right? But you would expect some of the same safety problems in kids and adults. The other really important thing to note that people actually don't know, but it's really important, there really has actually never been a vaccine that wasn't a live vaccine, but even very few live vaccines where there was a significant safety problem that showed itself after the first 2 months. So there really has never been a vaccine, and all the vaccines we've used where you've had these like long, a side effect that happened years and years down the line. Pretty much everything, the side effects, if you were going to see them, they happened within the first, usually 4 to 6 weeks actually, but it's in the trials, you extend that to 2 months just to be careful.
That's an important fact that's not out in the news, I think. That helps to make people, it certainly makes me feel more comfortable about the fact this hasn't been tested over years.
Yeah.
Makes a lot of sense. Are we seeing any distribution barriers for the 12 to 17-year-old set? So I know we've been reading a lot in the news about distribution for older folks. We won't go into that, but is it different for the teenage group?
It is, for a couple reasons, right? It is different, and the vaccine rates are definitely lower in 12 to 17-year-olds. Again, a huge regional variation. I mean, there's it's about, I think the last numbers I looked at were maybe 38% of teens were vaccinated. It's getting a little higher, I think, but that ranges from 10 to 60. So it's depending on the region that you're in. So there is a lot of regional variability, I should say. So, but there are a couple barriers. One, I think, is just some of the stuff we were just talking about, right? As a parent, you're often, as you should, you have a higher standard of what you of safety for your kids than you do for yourself sometimes. But we see that into all sorts of things. And so, parents, understandably want to know answers to their questions. They want to be able to say, could this impact my child in the long term? Could this, they want to be able to ask those questions. They don't always have a place to ask those questions. And there's a huge amount of misinformation floating around out there, a huge amount. And so it becomes very difficult actually for parents to discern what's accurate information and what's misinformation. So I think that's one big barrier. I think another barrier that we hear about sometimes is, that kids want it, but their parents don't, or vice versa. So that becomes the consent and assent of both the parent and the teen becomes a barrier. And also just in general, teens don't access healthcare as well. They don't get their well visits as frequently. They don't, so just in general, teens don't access healthcare as well. And so, thinking about ways that we can go where the teens are, schools or rec centers or churches, or, just same kind of way that we've thought about vaccination in all of our populations, but just thinking about, how can we be available in places where the teens are gathering.
Great. Well, let's dig into schools, because I think with school starting, that's where most people are thinking about kids and really caring. So before we talk about COVID and going back to school, let's talk about why we want kids to get back in school. So the American Academy of Pediatrics has been beating the drum. We need to get kids back in school. So talk about why that's so important. And before we get to the risk of going back to school, let's talk about the benefit and why you guys are pushing that so hard.
Yep. Yeah. There's so many benefits. I mean, I think, there are, and as, as a pediatrician, not an educator, I want to, be clear that I am valuing the expertise and what I'm hearing and learning from educators, but just from an educational standpoint, it is, that the education being delivered, it's much easier and effective it's much more effective to deliver education in person. And we're, what we're seeing over the past year is tremendous gaps in education, actually, for young people, not attaining the same levels that they have previously, big disparities in education. And so we're seeing a lot of that educationally, but from the health side of things, which of course is where I, live and feel more comfortable speaking, from a social emotional standpoint, it's incredibly important to be together with your peers. It's part of your sort of normal, child and adolescent development to be with peers and learning how to interact with them. It helps support your mental health. It helps support your development of executive functioning. You have to learn how to manage all the sort of, things come in, and how to manage your friend relationships and how to manage the distractions in the classroom. All those things are important for development of your executive function. They're also, for a lot of kids, there are services they get in school that they really can't get elsewhere. Things like food and mental health services and, special education services, which, that we have done really not a good job of delivering those virtually at all. And so a whole host of services that are offered in in-person school that just aren't available or easy to get virtually. And so, just really kind of a whole collection of, and I think, again, just emphasizing, I know we'll get to this, but we know from our experience that we can actually get kids back into in-person school safely. It is very doable. It requires the adults to do our part, which we don't always do, but you can absolutely do it even in areas of high community spread. I think the last thing I'll add to, just to acknowledge, there are actually some kids who did better going virtual. Because they were facing, disproportionate, discriminatory discipline or bullying or, not really well managed, all those distractions we talked about that you have to learn to manage, that they weren't able to do that and they were able to do that better at home. So I think it's important to learn from that and really ask ourselves, why is it that some kids actually did better at home, and how can we make our educational systems better by learning from that?
That's, you anticipated my next question. Well, so you started to talk about it's not that dangerous to go back to school, sort of that there are risks, but what is the American Academy of Pediatrics recommending? What should, and even from the perspective of a parent hearing about what's going to go on in their local schools, why don't you just talk about the layering of protections and what they should be in an ideal situation?
Yep, absolutely. And, again, this gets back to this whole concept of layering, because we know something is always going to go awry even in the best perfect school environment, something's going to go awry. So these layered protections are really important because they back up for each other. So, the vaccinations, making sure that everyone eligible is vaccinated. I'm really encouraged by what DC government is doing in terms of vaccination for teachers. I think that's the right choice. So anyone who's eligible being vaccinated, universal masking for everyone ages 2 and up. We know there are occasionally, it's not common, but there are occasionally kids who aren't going to be able to tolerate the mask as well, or who need to take it down for the developmental reasons or speech therapy. And if everyone else is wearing a mask in those rare circumstances, then, it just helps keep everybody safe, right? We're community, we're coming into some community, and that's what universal masking is about. It also, frankly, when we thought about high schools and the older kids, we thought, gosh, the teachers have already so much on their plate, getting kids caught up educationally and caught up, like, really, do we really want them monitoring who's vaccinated, who's not vaccinated? Hey, you like, do you wear an armband, if you're vaccinated or not vaccinated? I mean, so I think from a sort of pragmatic standpoint, universal masking in schools, at least right now, is really the right choice. Frequent hand washing, just like we've always encouraged, but perhaps a little bit more careful about that. That's, somewhat, COVID doesn't really seem to transmit via surfaces with any great, it's not a major source of spread, but it's always good to wash your hands. You touch your face, you wipe, rub your nose, like, it's always good. The ventilation is, I think, ensuring that you've got, decent ventilation going. I do think actually the enhancements that DCPS has made to the HVAC systems, I'm not no expert in this, but they do kind of comply with best practice recommendations, for the ventilation. And again, I think if I had to prioritize interventions, vaccines and masks are always going to be the two things. Okay. Like, vaccines and masks are, I think, always the two things that I think are going to give us the most bang for their buck. And ventilation is really important. Don't get me wrong. I'm not saying it's not, but I think, that's and then also just being careful, like, with distancing where you can, right? You're in a classroom, you've got kids, they're not always going to stay distant from each other, but setting up your desks in a way where people are reasonably distanced, setting up, so just making sure that you have that kind of, that you have a setup where you're keeping people reasonably as far apart as you can.
So you're talking about, this is the perfect environment. It would be great if you had every one of those things in your classroom. Right. I think all of us who've been involved with any school, but for those of us in DC public schools, don't really imagine that it's all going to get done right. So if you're a parent and you haven't had a chance to go into the classroom, so you don't know whether kids are really socially distant or not, should you still feel safe sending your kid to school? Because maybe kids are not going to be a full 3 to 6 feet apart. It's going to be too crowded for that. Is that something that should then begin to get you anxious and worried about your kid going to school?
I think I got to say, I feel very grateful to be going to school in a place where universal masking isn't a question. And I, so I think, given, again, these these recommended layered precautions are recommended and designed so that recognizing that there are system failures. There always are system failures. So, it's, my dad's a nuclear engineer. It's sort of like what, when they work in nuclear reactors, right? They plan for system failures. And that's what this school guidance does, is it plans for system failures. And so if you have the masking and the vaccines and regular testing and improved ventilation and, the desks set apart and, even if some of the kids sometimes squish them back together, if you've got these layered on top of each other, then you're really drastically decreasing your risk of spread. I think it's also important to know, right, we're going to have some patients. We are in, a pandemic that is quickly moving into an endemic, which means that it is probably something we're going to be living with for a while, and there will be cases, and what's important is how the cases are managed and whether or not there was spread, like whether or not someone, or a child or a teacher or staff member infected other people within the school. So all that to say is that I think with the precaution, I think that for my own kids, that gives me a lot of confidence. I am not thinking twice about sending my own kids in the school buildings. I will say that both of my kids are in our old non-modernized school buildings. So even knowing that they're old, decrepit buildings, I feel, I personally am feeling confident. I would also say that I think, I appreciate schools limiting the number of additional people coming in. I know it's hard as a parent not to be able to go in and check things out. On the flip side, I think, one of the things the schools can do is minimize the number of people coming in and out of the school building who don't really absolutely have to be there, because that does create a safer environment. So it's a really hard tension. And there may be times as a parent where you do need to come in and observe. And I feel like that's something you should be able to talk to your principal about. But
not generally. So I know that there's been a lot of discussion about how are we going to handle lunchtimes.
Mm-hmm.
So talk about your recommendations or the AAP's recommendations about how to safely navigate those times. And I know in DCPS, there's a fair amount of talk about kids coming out of their classrooms and into an indoor cafeteria where they're going to be sitting and eating. So how do we think about that for safety?
Yep. That's always, that one is hard in a lot of ways, simply because every school is set up differently, because the sort of physical, just sort of the physical layout of each school is different. And so that means that each individual school really probably has to think about that individually, which makes it really hard on so many levels, So I think, some kind of advice for individual schools, of course, if you can eat outdoors, that's great. That's actually that's a really good thing. If you can't, I think there are still ways to do it safely. So you may be in a cafeteria setting, but having, kids not sitting directly next to each other, having marked seats at tables could be a strategy, rotating kids through, classes through, so there are less kids in the cafeteria at the same time, being, just some vigilance on the part of whatever school staff are monitoring lunch, of asking kids to make sure they're putting their masks back on after they finish eating. Again, kind of talking about those layered protections, those sort of layered things to help prevent the spread of COVID.
But what I'm hearing from you, and I think that has been a concern from many of the parents who we represent, is if kids aren't socially distanced and they're together for more than a few minutes eating, that sounds like you're saying that could be a problem, that is something for parents to push back about. I think
it's a lower risk. It's not going to be, if it's the only time where they're sort of close and unmasked, I think some of our public health colleagues talk about, like, it's almost like you've got a bucket of pennies, right? And each penny is sort of one thing that increases your risk. And when you get to a certain number of pennies, then it's like, well, that's actually putting ourselves at a higher risk situation. And so I think, so like the lunchtime is a penny, right?
Yes.
And so it's one penny on top of a whole bunch of other things. And so, you have to sort of, try to take all of that into account. But I would say that, I think talking to your schools about, how to sort of design the lunch time and the lunch period in the safest way possible. But I think, it doesn't discount all the other safety precautions that are in place. It's not like all this other stuff has gone to waste because there is this time. So.
And
I hope that's helpful.
Yes, we just got a follow-up question, which is a very smart one, which is lunch isn't the only time where, but what about chorus or drama where people are singing, where they're vocally projecting? I know we all know that there were problems in churches early on. Is that something which we should stop doing as a school system right now? Or is it okay for kids to unmask and sing together?
Again, I think this is going to be, and again, this is where it gets, and I so feel for the school system, honestly, because it really is a case by case situation. If you can kind of set up a scenario where kids are well spread apart, you're probably going to want a little bit more space if you're really singing and projecting, right? But if kids are well spread apart, perhaps you can practice outside, or if you're inside, having it in a room where people are much further away from each other, then I think those are things that you can figure out how to do safely. It does require, I think it's going to require a little extra thinking, right? It's going to require a little extra thinking and a little extra planning. We also know that for some kids, that's a really important part of their social and emotional development. And so I think like so many things, as adults, we can be creative and innovative and figure out ways for our kids to do things that are important to them safely. I think that has payoffs, and that's really, really important.
And what about our pre-K kids who are napping still and eating snacks in the classroom? Is there anything different that we should be thinking about, or is the same advice, the layering of these sort of different pieces?
I think it's the same advice with the caveat that you're applying that advice to toddlers and 4 and 5-year-olds who are, it's like we were talking about earlier with the college students. It's a different, they have different developmental stages and behaviors, right? So you have to sort of think about how do these precautions, how do we keep these precautions in place with a different age group? And so, making, games out of mask wearing, maybe people, maybe an art project is you design a mask for yourself to make that fun, right? So that it feels, becomes more normalized in the classroom to wear masks and fun, for nap time, setting up, I think one great strategy could be to set up cots so they're alternate head to foot, so that you don't have heads all next to each other. You're alternating. You're looking at someone's feet as opposed to their head. So thinking about strategies like that, again, sort of taking advantage of the social distancing piece of it, because I agree, we don't want kids wearing masks while they're sleeping. But taking advantage of that. That's the physical distancing piece of the precautions, and really leaning more heavily on that during times where you have to back off on some of the other precautions.
Okay, I was about to summarize, but I got another question.
Of course.
Travel with unvaccinated kids. Yeah. Would you travel by plane across country, stay in hotels with an unvaccinated child today?
Yeah, the CDC recommends only essential travel if you're not vaccinated, and I would agree with that. I think again, I kind of often lean back on my own experience with my own kids, because I feel like it's how I've sort of taken all the information and then filtered it into decision making in a real world situation. But for our own kids, we did not take any plane trips until they were both fully vaccinated. And even then, we have taken a plane trip with them since, and we were super careful. We double masked. We were super careful about the travel. I think, but I also think there's other ways to travel, right? Cars. I think the hotel worries me less than the airport and the plane. I would also say, again, it's getting into some risk benefit. If this is, if you're traveling to visit a aging grandparent, and you are, sort of worried about their health and want the chance to see them, then those are different risk things. Now, of course, you also want to make sure you're cautious about the risk while you're there, because if you have an aging grandparent around, and but I think it's just sort of weighing those different pieces. But I think on balance.
So thinking from the parent perspective rather than the school system perspective, I want to make sure that I think that all of us want simple rules that tell us we're at risk or we're not at risk, and this is the amount of risk. And you're saying that's just not how the world works. That you can't, it's not a sort of simple grade and yes, this is safe and yes, this isn't, that we have to be in the world of taking risks. But and I hear that. I think it's a really important message for all of us. Can I see if I've gotten it right? Let me summarize what I think you're saying about, from the parent perspective, sending our kids to school. That the layering is as many people vaccinated as possible in a space. So teachers and older students and other staff. Universal masking. The more masks, the better. The more social distancing, the better. And where you can have a good air filtration system, you want that too. And I missed one, hand washing. So there's sort of 5 factors. And what I think I'm hearing you say is you don't need all of the 5 to work well all the time. So if your child is going into a classroom where the seats are only 2 feet apart, you don't have to just go, oh my God, I can't send them. They're not 3 feet apart. But it's only because some of those other things are in place, but you're expecting that masks are there. If there's a child in a classroom who, for mental health reasons or disability reasons, can't wear a mask or doesn't fully wear their mask, or there are a couple of those kids, again, we don't have to suspend that child or ostracize them. As a parent, I can feel comfortable mostly in that setting. Am I hearing the sort of your top line advice to us as parents properly?
Yeah, I think that's a good summary. And we want to achieve all of these layers to the best possible way that we can, right? And so I don't want us to think, well, we don't have to worry about that. We want to achieve all of those to the best possible way we can, but also then take some assurance away in that the reason that we recommend so many layers is because we know in the real world setting, they're not all going to work the way we want them to 100% of the time. And so that's why we have all these backup systems. Or backup
I guess. Thank you. And I see we're coming to the very end. So I want to end moving away from preventing our kids from getting COVID, which is what I think a lot, and go back to the other harms that the pandemic has caused. And we know certainly from our client community, how many folks have been at risk of homelessness and the anxiety of that, not sure where food's coming from, grieving for the loss of a family member who has COVID, along with all the fears. So can we end by having you talk about what we need to do to build back better from the mental health perspective for all of our kids?
Yeah, absolutely. And you know what, I'm even going to expand that just sort of like family well-being as well. And I think, this has been a really tragic time for our kids and our families on so many levels. The systems that we all knew weren't working well for them already proved that they really weren't working well, and in many cases failed. The politicization of all of this really harmed our kids. I think, as adults, we collectively haven't always done the right thing for our kids over the past year, but we have an opportunity, I think, looking forward to say, you know what, that this wasn't good for our kids over the past year. So how do we build it back better? And how do we really just overhaul and redesign things in a way that really meets the needs of children and families? And so I think from, specifically for mental health, but I think this can apply to health systems overall. I think, we need to make sure that we're making services and supports available to families where they live, work, play, and go to school. It's going to be, families are going to access the services, and they're going to be more effective if they're in places where families already are and are comfortable, and making sure that providing services in that way is sustainable. You have to pay for that. You have to pay our psychologists. We have to pay our, so we have to make sure. And I think expanding that to recognize that it's not just about, it's very much about the actual mental health professional, but it is also about the peer support services and the case management and care coordination, and the person at the primary care clinic or in the school who works with the family to help, make sure that they can get into safe, stable housing, right? Like all of those things. Making sure that part of the system is also built in and sustainably paid for, I think is really incredibly important. And then I think, I know we're at the end, so I'll just add one more thing. Yes. Really focusing in the long term on building up our workforce, and really building a workforce that has more expertise, that there's more people who have expertise in children and families, and more people who, a more diverse workforce, who can really represent the children and families who we serve. And that's not an overnight solution, but I think it's a really important long-term solution.
That's wise words. So as we're ending the program portion, I guess I should say, to build back better the way you just described, Dr. Beers, I want to encourage anyone who's part of this to join forces with Children's Law Center to do that. And you can do it by, if you're a lawyer taking a pro bono case, making a financial gift, spreading the word so that other people get connected to us and to this important work. Dr. Beers, it's always still a delight to be with you. So thank you for spending your time with us and for what you're doing nationally. And for those of you who are here, if you want to network, you can stay on the Remo platform. You're going to get transferred back to our virtual conference room. after a brief pause on the screen, you can double click on an empty seat and you'll get transported magically to that table and you can talk to the people who are there. If you want to find someone in particular, you can go to the chat feature and look through the attendance list to find out where that person is. And I hope to see all of you again later this year at our next program. Thank you, Dr. Beers.
Thank you.
And I think we'll get transported back to the main room.